Hello everyone, and welcome back to another episode of Availity Unplugged. Authorizations have been a hot topic in our industry for some time, and with the recent acquisition of AuthAI, we thought it might be a good idea to get Matt Cunningham from the AuthAI team and Krisi Hutson together on the Unplugged set to talk about Availity's authorization strategy.
The payer's responsibility is to pay for it, right? And they're also responsible for aggregating what evidence-based literature they're going to use in order to govern the benefit, right? So we like to call the medical policies that are used are kind of it's the mix between a doctor and a lawyer combining and writing a document, right? So even ChatGPT is not going to make that much easier. It's truly going to be kind of like, what's that conversation? And in a lot of cases, there's sort of questions on whether or not there needs to be exceptions to that medical policy, right? So you sort of get this responsibility of the payer to be that aggregator of the clinical science, and that's not really necessarily what health plans are designed to do. And then you try to have a conversation around what's important for that patient when they're not in the room with the patient, right? So you really are sort of sitting as a in-between sort of enforcer as the process instead of a partner for the provider in terms of making sure that they're sort of moving forward the evidence-based literature, right? So that's really where the provider and the payer kind of sit across from each other at the table. And so that creates this sort of lack of trust in some cases. It's sort of just this aggregated conversation, which prevents partnership, right? So the current state really is sort of this, what I would say, adversarial, enforcement role for the payer. And I don't know that necessarily lends itself towards really significant movements in automation either.